Good afternoon, everyone, and thank you for joining our September Telehealth Learning Collaborative hosted by the North Country Telehealth Partnership. This is Nancy Del Mastro, Telehealth Project Manager with Adirondack Health Institute, and we're happy you have joined us this afternoon. Looking at our agenda, we're going to start with some federal telehealth policy updates, a bit different than our normal schedule with our state policy updates. We are focusing on our federal updates today because next week, our North Country Leadership Summit, our annual conference, will be happening up in Lake George, and we will be hosting the New York State Regulation and Reimbursement Telehealth Update with our DOH, OMH, and OSS partners, which we are very excited for. So we will be spending a full hour with our panelists from the state agencies who will be going over all of the updated policies and regulations and answering questions. In a little bit, I will put the link to registration in the chat if you haven't yet registered but are interested in joining us. I am also going to be working on a full Q&A document from that panel, which will include all of the questions and responses from our state partners. And I'll definitely be sharing that with all of our contacts and our attendees that we work with. So if you have any questions about that, feel free to send me an email. But with that being said, we'll get right into our federal updates. We're going to start with Kelly Robinson, who is with the U.S. Department of Health and Human Services, specifically the Office for Civil Rights. And Kelly will be discussing some telehealth considerations and HIPAA policies. So Kelly, I'll turn it over to you.
Okay. Good afternoon. My name is Kelly Robinson. I'm an investigator with the U.S. Department of Health and Human Services, Office for Civil Rights. We enforce civil rights statutes that prohibit discrimination by entities that receive HHS funding. We also enforce HIPAA privacy, security, and breach notification rules. Today, I'm going to discuss press releases, guidances that OCR released specifically for telehealth regarding HIPAA. Because as we know, HIPAA, privacy, security, that's like a whole training module. So I'm just going to focus on those areas. How HIPAA applies to telehealth. First, the HIPAA privacy rule requires that covered entities apply reasonable safeguards to protect the privacy of protected health information when providing telehealth services. The HIPAA security rule requires that covered entities assess the potential risks and vulnerabilities when using electronic communication technology and requires it to be addressed in covered entities' risk analysis and risk management plans. In March of 2020, OCR issued a press release and guidance announcing that OCR would exercise its enforcement discretion and would not impose penalties for non-compliance with the HIPAA rules against providers who use audio or video communication technology to provide telehealth services during the COVID-19 public health emergency. This meant that providers could use any non-public facing remote communication product that was available, such as Skype, Zoom, and FaceTime. OCR provided guidance explaining how covered healthcare providers can use remote video communication products and offer telehealth to patients responsibly. Providers were encouraged to notify patients of privacy risks and to enable any type of available encryption and privacy modes while using the applications. OCR explained and provided examples of non-public and public-facing video communication applications. OCR also provided a list of vendors that represented that they provided HIPAA-compliant communications, and they would enter into BA agreements with providers. In June of 2022, OCR issued guidance on HIPAA and audio-only telehealth. OCR highlighted the benefit of telehealth and that certain populations may have difficulty assessing or accessing or being unable to access technologies used for audio, video telehealth because of various factors such as financial, disability, geographical areas, limited English proficiency. So they listed, some factors that individuals may not be able to access video communications. Now we fast forward to the present to 2023 with HIPAA and telehealth. In April, OCR announced that the COVID-19 public health emergency HIPAA notifications of enforcement discretion would expire on May 11th of this year. This included the telehealth notice of enforcement discretion. OCR provided a 90-day transition period for providers to come into compliance with the HIPAA rules. The transition period expired August 9th, 2020, which means currently enforcement has resumed. OCR just recently in July issued a press release with the Federal Trade Commission warning hospitals and telehealth providers about privacy and security risks from online tracking. The press release cautioned hospitals and telehealth providers about the privacy and security risks related to the use of online tracking technologies that may be integrated into their websites or mobile apps that may be impermissibly disclosing patients' personal health data to third parties. OCR and the FTC sent joint letters to approximately 130 hospital systems and telehealth providers to emphasize the risk and concerns about the use of technologies that can track a user's online activities. The joint letters can be found on OCR's website. For additional information regarding HIPAA, telehealth, OCR's website contains all the press releases and guidances that were issued, including frequently asked questions. If you haven't already, you can sign up to receive up-to-date HIPAA releases on the website through the listserv. I'll provide the links. Am I providing them to Nancy to distribute to the providers?
Yeah, Kelly, you can certainly send them to me and I will include that in the notes document. You can also, if you have them handy, pop those links in the chat if you want. But
Oh,
just for our attendees, we'll definitely have them in the notes as well.
Oh, okay. If anybody has any questions, I think you were taking it at the end. I kind of try to go through just those things because I knew I was limited with time. So, like I said, HIPAA is actually, training modules, you can go through. But those were really the uh like the important documents and press releases that were geared directly towards telehealth. And like I said, they have guidances. The press releases are on there. The letter is currently on there that was sent out to providers and hospital systems, letting them know about the web tracking now, which is a hot topic, that's being addressed.
Thank you so much, Kelly. Yeah, so all of our attendees, please, if you do have any questions specifically for Kelly, feel free to pop those in the chat and we'll be sure that she gets them. We'll probably just move right into our next speaker just to keep things moving along. And then at the end of the session, we'll go through the full chat and question panel to see if there are anything specific. But thank you again, Kelly. Like she mentioned, HIPAA and privacy there's such just a slew of information to know and training modules. So we'll be sure to include all of those links for your easy reference with the notes. So again, if anyone has any questions or comments, you could always email them to us as well, and we'll be sure to get those to the proper leaders such as Kelly.
Yes, no problem. Any questions, any
Mhm.
updates we can provide whenever you have your meetings, we're more than welcome to do it.
Thank you so much, Kelly. And with that, we're going to move right along and we're going to have Tony Jamrazi from CMS, who usually provides our federal updates, just do a really quick reminder of what was included in the proposed CY 2024 Medicare physician fee schedule, and talk a little bit about remote services by hospital outpatient departments and FQHCs. And Tony, feel free to keep this high level. I know we've described it on our last learning collaborative as well, and whatever you think our participants may be interested in.
Sure, Nancy. And the basic news is not much is going to change until the end of 2024. And that's basically because of the Consolidated Appropriations Act of 2023. So in other words, the patient can be anywhere in the United States to receive telehealth, including their home. And the services are basically the same services that were covered under the pandemic, which is a listing that was put out in March of 2020. To the end of 2024, uh, uh, occupational therapists, physical therapists, speech language pathologists, and audiologists are still considered telehealth practitioners for Medicare purposes. And the prior 6-month inpatient rule for mental health services, mental health telehealth, is also on pause until January 1st, 2025. The only two new general things is that marriage and family therapists and mental health counselors, effective January 1st, 2024, are considered practitioners for Medicare Part B, and they're permanently able to provide telehealth services by being included in the section of the law that defines practitioners for telehealth services. And the other new thing, and this was something in last year's final rule, on January 1st, 2024, the modifier 95 dies, and you code the telehealth services based on place of service. O2 means the person's not at home, and place of service 10 means the person's in their home. What I wanted to mention about outpatient services was there was a pandemic waiver that allowed a hospital to define a patient's home as part of their outpatient department. And when services were rendered to the patient in their home, they could bill both under the fee schedule and under the outpatient prospective payment system. That waiver died on May 12th. However, for physical therapy, occupational therapy, speech language pathology, and audiology, hospitals can bill under the outpatient prospective payment system for services provided by their staff to patients in their home, on the proviso that there's no professional billing at the same time. So that's what I have.
Thank you so much, Tony. And as mentioned before, if there are any questions specific to our federal policies that were just discussed by Kelly and Tony, feel free to add them in the chat, or you could email us after, and I'll be sure to connect anyone with a question to our expert panelists. And with that, we'll get right into our featured presentation. Today, we are lucky to have Dr. Marela Fiacco from SUNY Canton discussing a recent research study that she conducted entitled The Effects of Telemedicine Services on Patients Who Receive Behavioral Health Services in Rural St. Lawrence County. So with that, I'll turn it over to you, Dr. Fiacco.
Thank you so much, Nancy. Can you hear me?
Yes.
Oh, good. Thank you. Always have
Very
to make
clear.
sure with these things. I really appreciate the opportunity to be here today and to share this research with you. I am also, as I'm listening to Kelly and Tony, really encouraged by what's going on on the federal level and the updates. So it's really good to hear about the mental health reimbursements, and I will also, as part of this research, you will see a little bit about what patients have to say about their privacy and such. So it's really a good segue. So I appreciate that. So with that being said, I am an associate professor and a chair of the healthcare management department here at SUNY Canton. I worked in collaboration with St. Lawrence County, with St. Lawrence Health System, excuse me, and their research team last year on gathering some data on telemedicine, on the effects of telemedicine in the behavioral health services and Dr. Zolo's practice, whose patients were surveyed. So without further ado, I will share some information with you. And, oh, why can't I proceed? Ah, there it is. Thank you. Our computers are not the best. A little bit about St. Lawrence Health System. As many of you might know, we're located in rural St. Lawrence County, comprised of 3 hospitals now and outpatient clinics due to recent mergers. Closest tertiary medical center is about 2.5 hours away. Total inpatient capacity, 144 beds. This is just a quick overview. You can see here some health indicators for St. Lawrence County, and as it compares to New York State average data, you can tell that we suffer from, in rural areas, from poorer health, mental health days, adult obesity, access to various opportunities, preventable hospital stays. There's also substance abuse, and so on. So you are probably aware of many challenges and issues that rural communities face. So this study was important to us to look at how telemedicine can help in those areas. So as you all know, that the COVID pandemic really exacerbated the mental health crisis and the challenges of delivering mental health services. So this study was created to explore the use of telemedicine tools in delivering mental health services. So, of course, some of the overarching challenges faced by patients seeking behavioral health services in our rural communities are accessibility, availability, and acceptability. You're all probably not strangers to these challenges and that all rural communities face. So folks have longer travel time, sometimes lack of insurance. Typical of rural areas is lack of providers for mental health services in comparison to urban areas, lack of training, sometimes lack of coordination among providers. Acceptability in terms of lack of compliance with medications, awareness, education. There's a lot of association between mental health and substance abuse, patients less likely to recognize an illness. So we really wanted to explore telemedicine tools in that area to see if those are viable alternatives to face-to-face delivery, especially during COVID. And in St. Lawrence County, and New York State Department of Health's Community Improvement Plan objectives through 24. Of course, mental health and substance abuse prevention are one of the top ones. County specific, we want to address recent increase in suicide rates, emergency department visits, our worsened mental health overall. Approximately 1 in 6 residents in St. Lawrence County said that they have experienced challenges or difficulties receiving behavioral mental health in the last 12 months. So we wanted to explore those telemedicine tools, but we also, as you'll see, explored how they relate to in-person visits and whether those are viable alternatives to the face-to-face delivery. So we wanted to gather some understanding of what the providers and patients' perceptions are and willingness to use telemedicine and other remote tools. And you mentioned audio. So we looked at audio, video, face-to-face. So all of those questions, all of those different modalities that we really wanted to explore. So just to make sure that you understand that this was a quantitative correlational study where we are exploring or investigating the effects of patients' perceptions on different levels. So we wanted to look at usefulness, ease of use, reliability, and effectiveness of telehealth tools. So both video and phone and in-person visits on patient satisfaction. So these results may not only provide practical implications for healthcare providers and administrators, but also expand on the technology acceptance model by exploring two specific beliefs, perceived ease of use and perceived usefulness characteristics. And so just to expand on those models and those theories. So the theoretical framework, as I mentioned, was the perceived use and then perceived usefulness. So we combined two different questionnaires. Those were previously validated instruments. We used ANOVA to explore the results and analyze the variations between groups for each of those modalities, because we wanted to see the level of patient satisfaction with each of these independent variables, the usefulness, ease of use, reliability, and effectiveness, with patient satisfaction being the dependent variable. So this study in particular is really interesting and good to me because I was able to work with, we received a grant, first of all. It's a Walker Fellowship grant that supported this work. It's a grant that is available to 4 associated colleges in the area: Clarkson, St. Lawrence, SUNY Canton, and SUNY Potsdam. So we have a pool of money where this grant is available for research when we collaborate with local providers. So this study was done together in collaboration with St. Lawrence Health System Clinical Research Team and the St. Lawrence Health Behavioral Health Clinic. So the research question was that, we were wondering if there's a relationship, if at all, between any of the independent variables, like I mentioned before, the ease of use, usefulness, reliability, and effectiveness of telemedicine modalities and in-person visits, and patient satisfaction. This was the recruiting was done qualifying patients 18 years and older, any gender, ethnic background, socioeconomic status, who have visited the clinic in any modality within the last year. We did exclude those patients with dementia and psychosis, as advised by Dr. Zolo, who is the director of the clinic. So, we proceeded with all the other diagnoses. Qualified patients we reached by phone was 204, 174 agreed to participate, and then we ended up with 111. Two surveys were excluded, or responses due to submitted without answers to questions. So it was a good response rate, I would say. For anyone who does research, 64% is probably pretty good. Even if you send out a survey, to your members for anything, you always hope for a good response rate, so you can have good data. And so here are some findings. Demographics: about 70% of the respondents are female. Now, I do want to mention here that this was not a confounding variable. We learned from Dr. Zolo that a vast majority of his patients are female gender. So it was not surprising to see 70% of the respondents to be females. 95% or so white non-Hispanic, 46.8 high school graduates, 25% of the respondents between ages of 25 and 34. So this was actually interesting because the age ranges actually about a quarter, 25, 26%, that percentage was spread out between age groups. So this is to say that even those 55 and older, a pretty good percentage of respondents use telehealth services and participated in this survey, as you'll see in a minute. The telehealth tools mostly used, the respondents responded, it was Google Duo with the most used telehealth tool, followed closely by Helo and FaceTime. We also asked them what type of social media they use, and out of all the social media available that we listed as options, about 84.4% prefer Facebook over other social media, which didn't really surprise us, but you know. So you can see here the mean overall satisfaction out of 5. The in-person was 4.3, video 4.29, and then the phone closely followed. So this goes to show us that the patient satisfaction did not decrease with use of video or phone, and we didn't really find statistical significance to reject and say that the patients were not satisfied with using telehealth tools. So that was good, I guess, for Dr. Zolo's office. And so you can see here further our findings in terms of phone modality and video modality, some variables that strongly predict patient satisfaction. So we selected the top ones. So the top one for both phone and video modality was that it saves time traveling to a clinic. And then easy talk to the clinician over phone, and privacy protected. So this goes back to, as I was listening to Kelly's updates on HIPAA in terms of, and this is really good to see that patients felt that their privacy was protected, even though they were using telehealth tools, whether it's phone or some type of video modality or some type of video tool. The patients also expressed that it was easy to learn to use the system, and they felt comfortable communicating with the clinician when using video modality. They also said that they were able to express themselves effectively using a video. So some of our recommendations are that we do see the benefits of telehealth in delivering mental health services in rural areas based on our findings. Clearly here you're seeing a snippet of it and not all the questions and the whole survey and everything, which I am happy to share if you want to see. But in essence, patients reported a good experience, that their privacy was protected, saving them time traveling. It was convenient. Insurance covered it, and they were more comfortable actually sharing sometimes over the video and phone versus in person. Some considerations and takeaways from the open-ended question that we had on our survey was that some patients lacked access to technology. So this is a really good indicator, or I guess data to know for your group. Some expressed poor connection, that it was hard or to hear or see. We do have pockets in St. Lawrence County, especially where service is not the most reliable. Some folks don't have broadband, they don't have good data or even towers, to use their cell phones and good service or Wi-Fi and so on. Lack of private space was one. So that, providers should definitely take into account interruptions, whether they're doing it at work or whether they're, consulting with their physician and children are around, or, and so on. They did express a long wait time sometimes, that the physician was not on time and there was no communication. So this was good for the providers to know. Some clients lacked insurance coverage for telehealth. So I'm really happy to hear Tony's updates and extensions and such, and what's included in mental health services and for the reimbursements. Is definitely is a good alternative to consider. Of course, there is no one size fits all model. Not every provider will have the same experience. Not all the patients are going to have the same experience. We definitely want to look at future studies and analysis on, patient satisfaction and ease of use, maybe looking at demographic groups, looking at the costs and the impact, and so on. So there are a lot of different ways to look at the data, from here on out. So there are some references, and I will stop sharing and turn it over to Nancy. I do appreciate your time today, everyone, and I will share my presentation with the notes that are provide more information than what I provided here, because in the interest of time, I didn't want to go on forever. So I will share it with Nancy, and then she can share it with the group. Thank you all.
Thank you so much, Dr. Fiacco. That was excellent, and I'm sure a lot of our attendees, knew some of these things, but always seeing new research and some quantitative studies also, really just reinforces and supports our work with telehealth. So this was really exciting to learn more about. Like mentioned, if anyone does have any questions, please feel free to add those to the chat or the Q&A box. I don't see any right now, but I will just make sure everyone is aware that Kelly did link all of the different notices from the Office of Civil Rights in the chat that she discussed during her updates on telehealth and HIPAA and privacy. So feel free to check those out. And like mentioned, I'll be sure to include those in the notes as well for reference later on. And then while we wait to see if any other questions do come into the chat, I'll just go ahead and share some of the updates that we included in our agenda. And again, those will also be included in the notes. I already did put the registration link to the North Country Leadership Summit into the chat. That is occurring next week, Wednesday and Thursday, the 27th and the 28th. The 28th will include the New York State Telehealth Regulation and Reimbursement Panel, an update from our regional director of HRSA, and a slew of other really great breakout sessions from regional partners and telehealth experts on telehealth and population health. The agenda for both days of the conference is included at that Eventbrite link that I had included, so feel free to check that out if you haven't yet. And as a reminder, registration does close tomorrow as we are getting everything prepared for next week. I also wanted to remind everyone that the New York State Department of Health is conducting a telehealth provider survey. You might remember that last fall and spring, or maybe I can't remember exactly when, but we were promoting the New York State Department of Health consumer survey, and the findings from that were released recently. So we're really excited to see the provider survey come out, so all of your perspectives can be heard and hopefully have some positive impacts on future policies and considerations. So I'm going to go ahead and place the link in the chat as well for that. If you haven't taken that survey, it's probably pretty quick, 5 minutes or so, and super important to have the perspectives of our North Country providers included for what our state partners are hearing. So I did just place that in the chat. And if you scroll down, there's a box that has a little bit more information about the survey and a link to the SurveyMonkey link that they're collecting the data on. So feel free to take that, also share it with your colleagues and other providers in your practices. The more perspectives, the better. Also included in our agenda were some other really great events. Today I actually did start Telehealth Awareness Week. This is hosted annually, this is the third year, by the American Telemedicine Association. And it's a really great way to promote and highlight the importance of telehealth. And I'll go ahead and place the link for that in the chat as well. They're hosting quite a few different events throughout the week. Really great free webinars from different experts on telehealth topics, a lot on policy, and different successful programs throughout the nation. So I'm going to place that in the chat in one moment. And I encourage you to, take a look at the different sessions that are happening throughout the week and different opportunities associated with the American Telemedicine Association. So that just came into the chat as well. And again, these are all linked in the agenda that I had shared, and they'll also be included in the notes document. Other than that, the agenda did include some other individuals, individual items on updates regarding different opportunities, links to other research and articles on telehealth and whatnot. I know that it did include the DEA was hosting public listening sessions last week on the 12th and 13th to hear public comments on prescribing controlled substances via telehealth. In the notes document, I'll include any updates from those. I think they were synthesizing all of those comments, so I'll make sure that those are circulated as well with the notes. I also included a new certificate program that's being offered by the American Heart Association. This is specific to certifying individuals on the commitment to providing telehealth care, which is really great. It's an online program, includes research, hands-on experiences, and best practices. So check that out if you're interested. And again, we'll make sure that there are other opportunities included in the notes. There's a couple of other webinars coming up this week. The National Telehealth Resource Center is hosting a webinar on a rural West Texas telehealth program. And next week, there will also be a webinar on innovative strategies for telehealth implementation at the University of Mississippi Medical Center. And again, our conference, we really hope to see everyone there. This will be our first year back in person since the pandemic, since 2019. So we'll be really excited to see everyone's faces there. And again, with the telehealth panel that we'll be hosting, we'll be sure to circulate all of the questions and answers that are discussed during that panel to all of our partners. So, you being on this webinar right now, I'll have your emails. And if you weren't on our master telehealth contact list, I'll make sure you're included so you receive those updates next week. I still don't see any questions in the chat for Dr. Fiacco or our federal partners, but with the notes, I'll also include, my email address. And if you're okay with it, Dr. Fiacco, Kelly and Tony, perhaps yours as well. And, if there are any questions that anyone thinks of after the presentation is over, feel free to email those over and we'll make sure to address those. Okay, we have a quiet group today, but that's totally fine. No, everyone's so busy. I'll be happy to give everyone 20 minutes back in your day. As a reminder, this is recorded. So with the notes, I'll be sharing the recording. If you want to, reference anything that was discussed back, we'll also have the slide decks and all of the links to the federal policy updates that were discussed. Thank you again for joining us, and we hope to see you next week at our annual conference. Have a great rest of your day.